Hello, welcome to SalivaCast. I'm your host, Dr. Deborah Haller, today to talk to you about a very important and interesting topic: waistline to gumline, implications of obesity and metabolic syndrome in oral health. And to talk about this topic, I have the expert in the field, leading dentist and scientist, Dr. Sukirti Ganeza, my dear friend. He's associate professor and director of the Advanced Education Program in Periodontology at the University of Iowa in the United States. And today we want to talk about the importance of having this knowledge as a dental clinician and how this really needs to be in our dental practices. And Dr. Sukirt here has this very leading expertise in this team. He's leading voice in periodontology now worldwide, and I'm so happy he's here with us to talk about this connection of periodontal health and systemic health, and the importance for us as dentists to bring this to our patients in our daily clinical practice. He has done some very interesting research published already in very renowned journals, and he's here to translate this all for you, dentists, to your clinical practice, so together we can bring more health to our patients. Dr. Sukirti, it's an honor, a pleasure to have you here with us at SalivaCast.
Thank you so much for having me, Deborah. It's a pleasure to connect with you and all the difference you're making with the community, connecting from Barcelona here. So thank you so much for having me and for the kind introduction.
Very nice. I would like you to translate to the dentist that's watching us the importance of understanding this connection. Let's start with that, to look at the patient as the whole and to know that the oral health is connected to their systemic health, and it's a bidirectional link.
Absolutely. That's a great point. I know we're getting a lot of understanding of this, of understanding between the oral health and the systemic health. So, for example, when we think about a patient walking into a practice, one of the things that's popping up a lot now is we know that there's an emerging problem with increase in obesity, increase in metabolic syndrome, increase in these chronic, non-infectious pandemic, almost a disease that we're all dealing with. And for example, in the United States, 1/3 of the population is obese. So, which means that every third person who's walking into your clinic is going to suffer from obesity. Depending on where your demographics are located and where you're practicing. So, it is important for us to know that the whatever happens in the body also affects the mouth, because mouth is part of the body, and whatever happens in the mouth also affects the body. So, that is the most important thing for us to understand, that start treating patients as a whole and not just looking at the specific curious lesions or specific pockets. It's treating the person as a whole.
Perfect. So dentists, put up the volume, because this is your patient today. So the chances are that you're attending obese patients at your practice. So you need to understand the impact that this have in their oral health and their systemic health. And if you could explain to us how the metabolic dysfunction affects the oral microbiome and inflammation in the oral cavity, because I know you've done substantial work in this area.
Absolutely. When we think about obesity, there's another layer to obesity, and that's metabolic syndrome. So when patients have obesity, which means that you have an increase in your waist circumference, but metabolic syndrome is another layer of complication. You not only have an increase in waist circumference, you have changes in your cholesterol levels. That could be an increase in triglycerides, that could be increase in your low density lipoproteins, or it could be changes in your glucose levels, that you're developing insulin resistance, or you have blood pressure. It's a combination of these factors, and there are various definitions of how do you diagnose metabolic syndrome. But the bottom line, what we identified is that, when someone is obese or when someone has metabolic syndrome, we all know it's a chronic inflammation, right? So because of the adipose tissue, there is a chronic inflammation in the body. But what was so interesting for us was when we identified, these patients, And when we have them, collect their swabs, their subgingival plaque, their saliva, and we looked into how does the microbiome change or how does the body's response changes in the oral cavity, we actually identified some really interesting features. The first thing we saw was we all know that the oral microbiome and the host immune system has to work together to keep us all healthy, right? It is important to make sure that that healthy interaction stays healthy to make sure that the patient doesn't get periodontal disease or doesn't get cavities, right? It's the most important, two most major diseases. So what we identified was that even in a patient, when someone didn't have any dental caries, someone did not have any periodontal disease, if you collect their saliva, especially in the pediatric population that we recently published in Journal of Dental Research, and we looked at their microbiome, the microbiome of the kids who are obese or the kids who are diagnosed with metabolic syndrome looked like someone who would have periodontal disease.
Wow.
So it's like trepaneme.
And they don't have their oral health. They have oral health.
Correct.
Wow.
And we control for all possible factors, making sure that because the diagnosis was between 10 to 17-year-old in our adult or pediatric population, we didn't have anybody who were on braces, because then that is a confounding factor, right? So nobody had any orthodontic braces. We made sure that there was an equal distribution of primary dentition, mixed dentition, and permanent dentition. So we control for all of this. So despite controlling for all of that, and oral hygiene, because we know that pediatric population tends to have higher amount of gingivitis or plaque-induced gingivitis, right? But we made sure that all of this were controlled. And even with all of this controlled, we were able to identify that the microbiome looks like a pathogenic microbiome, even in the absence of clinical dental caries or clinical periodontal disease. And all these kids have is just obesity and metabolic syndrome.
This is a very important red flag for the clinician.
Correct.
Because if we're solely looking at the oral status with the clinical exam, we are not seeing any disease there.
No.
But what you're translating here is that the saliva microbiome is giving you information to add to that care that is showing a change there.
Correct.
That's the result from this systemic change in these patients. This is very important for the dentist to know when seeing patients obese and with metabolic syndrome.
Absolutely. And the other interesting factor that we identified was because when you study microbiome, a lot of the times, it is important to also study how the immune response happens. How does the cytokine response in the oral cavity happens? Because that's how you understand the entire cooperation between the two that we always talk about. But what we identified also was that, first thing we wanted to see was, because all these people were diagnosed clinically and we were recruiting this population from the pediatric cohort in the Children's Hospital, we wanted to see how did any of the adipokine markers, can we find anything? And what are the two important things people talk about? One is leptin, the other is adiponectin, right? Leptin is always increased in obese patients and metabolic syndrome patients. If you take the blood and test for the leptin levels, it will always be increased. And adiponectin is considered as a cardioprotective metabolite. So if you have adiponectin, it's usually, it's present in normal weight healthy kids, not with the. And we wanted to test those adipokines to see what we do. And in saliva, it was very interesting and shocking to see that the levels of adiponectin was so much higher in the normal weight healthy control, which is a cardioprotective metabolite.
Yes.
And it was to the bottom in obesity and metabolic syndrome. And the leptin was the opposite. It was higher in these two. So it gave us two things. One, when you do a research like this with a cohort and you're publishing for the first time, it gave us a biological validation for our cohort. Then we know that we picked the right ones because the body tells you exactly. And the levels are also very similar to what you find, mirroring the levels of in the serum, in the plasma. And the other takeaway from this is just from asking the kids to spit into a 2 ml Iprendoff tube.
So it's completely painless, non-invasive test that we can do in our clinical practices. For now, we have the oral microbiome test that the dentists can do in our practices. So it's
So we
completely
can find, yeah,
non-invasive.
to find that, if someone's how is someone's obesity status is, someone's we are able to identify that. On top of it, we identified, of course, like some of the pro-inflammatory mediators that are increased in the
Increased
in the inflammation in the saliva of these. And then we would also do a full metabolite assay, because at the end of the day you can understand the microbiome, and then if you understand how the host responds to it, but the interaction between the two is the end products. That's the metabolites. So we wanted to include that also. So we have the metabolites, we looked to the metabolites, and again, we were identifying all these metabolites associated with health. Like, for example, glutamate or glycerol, like we find them all decreased, in these population of obesity and metabolic syndrome, and a lot of changes in the tryptophan metabolites, which is, plays a central role in the microbial mucosal homeostasis. So we put all of the puzzles of these pieces together to actually understand how this complex environment of the interaction works. And we have the same cohort, we also have an adult cohort that we're able to identify.
I understand. So you're also seeing these changes in adults
and in the subgingival microbiome, that we are getting ready to publish that big data also.
This is very interesting. And this for the dentist.
Yes.
This is, listen to us. If you're connected here at SalivaCast and you want to share this episode with all your dental colleagues that are watching this, because this is a big red flag, and this information we need to have in our clinical practices. We're seeing obese patients, we're seeing patients with metabolic syndrome, from children to adults. And what Dr. Surkit is explaining to us here is when he analyzed the saliva of these patients, and even when they have oral health, so they don't have cavities, they don't have gum inflammation, but their saliva is altered in its microbiome, similar to the microbiome of a patient with gum inflammation, with periodontal disease.
Exactly.
So this, for us dentists, gives us the ability, when we include the saliva diagnostics, to really to see it beyond.
Absolutely.
Right? Beyond just the clinical exam, because the clinical exam is not showing that this patient is at risk.
So there's a subclinical, and one of the things,
subclinical that the saliva shows
is picking
you.
it up. Exactly. So, the next step, as I said, this is in a cohort of, closer to 80 patients in Iowa. It'll be fantastic if we can expand this to a different cohorts across the different parts of the world, different parts of the country. And then, a lot of these assays right now are done in the lab, but that's the future to go. If we are able to validate this, when we are able to validate this, and we're able to say, someone's going to spit in the tube, and you see whether their leptin levels and their adiponectin levels, to say where they are with their cardiovascular risk, and then identify. And one of the things, the implications you think about all of this comes down to, so what do? We have all of this, so what do we do? And when I say we need extra care for these patients, or like we need personalized approaches, I'm not talking about doing a gene editing and changing the bacterial flora, or making sure that you do. I'm not talking about any of those complicated things. All I'm saying is that if someone is obese, if someone has metabolic syndrome, what is the best way to keep the dental caries and gum infections away? See your dentist more often. Right? So if you see a dentist, say, every year and get a cleaning, in some countries, if you say every 6 months and get your cleaning done, you're keeping all these bacteria away, you're keeping all of this inflammation away. Every time you do this, you're resetting the clock. But maybe when patients are obese, metabolic syndrome, like how we deal with diabetes or smokers, we may have to put them on every 3 months or every 4 months, instead of seeing them every 6 months and 1 year. And I understand there is a lot of implications here, because who's going to cover for these things? Who's going to pay for all these visits? Or even private or government insurances, right? But that's where we also need to make sure we involve the policy folks. That's the next part of the work we do, where we actually work with our, trying to work with our, policy folks to see what other data we would need to show that can we categorize these populations as high risk, so they get to see us more often.
This is very important. Dentist. This means that you With this knowledge that you just got here at SalivaCast from Dr. Sukert research, you will individualize and personalize the appointments, the how often your patient will come to your clinical care, because you know that obese patients will need to come more often to your dental practice. So you cannot wait. When we act truly in prevention, and this is, we're acting here prevention one step above, because we're using salivary diagnostics to guide this prevention, to see, we know that these patients that are at higher risk, we're seeing changes in their saliva microbiome here.
Much
So
before the clinical
much
starts.
before the clinical inflammation starts. So clinically, this is, I'm so happy we're doing this podcast, because clinically nothing is there yet. But we're seeing the changes in saliva's through the microbiome. You're also seeing inflammatory metabolic changes through saliva diagnostics there. And then we know this patient is at risk. It's a subclinical alert change.
Absolutely.
We do not see it in the clinic with the regular perio exam, right? With the probes that you train the dentist how to do. So we do not see it with the regular exam. But once we include the saliva diagnostics, we can truly can see what we couldn't see before.
Exactly. Yeah. And now, the other thing is, in the study, this is a cross-sectional study, right? I am looking at that specific time point of how these things are. We had a huge inclusion-exclusion list, but we do have an active longitudinal study now. So we actually have a lot of 2-year follow-up on these patients. When they go through the lifestyle changes, what happens. So we're excited. We know that's going to be adding another layer of information to us and saying, when someone's body is improving, how does your oral health change? How does these things? So maybe in the next 2 to 3 years, we'll have that data to actually come back and talk
to see the impact of having a healthier lifestyle and its impact on the oral microbiome and oral health.
Absolutely. Yeah. So, and it's even though we are able to identify the changes in the adult and the pediatric population, there are some of those molecules or signatures are very similar. But of course, adults being an adult, the age dependent, you can see the differences too. But the underlying message is very clear that your body does respond to, or your mouth does respond to, how there are changes in the body happens. And I think, and this is also another important thing, I have at the University of Iowa, we do actually have one of the nutrition specialists as part of the College of Dentistry. And so this is also important, where that we can't just look at the probe, check things, but ask the patient some nutrition or diet counseling, because that should be part to say, hey, we're taking care of all of this, but just because you got the cleaning done doesn't mean it takes care of your oral health. Maybe you got to make sure you refer to a dietitian or a nutritionist, or at least that conversation. And a lot of the places, the patients see dentists more often than they see their physicians, right?
Very good.
So I think it's important for us to also play the role and have a conversation and say, this is important. And I had this question a lot when we started the research study in 2019. I've had questions of why is a dentist here in the endocrinology clinics, and I was in cardiometabolic clinics, and why are you here? What are you doing? So I had to sit down and explain. And the bigger thing is to get that buy-in from the doctors. So now we have a big referral base from these clinics, and they will say, doctor, I saw this patient and they said they've not been to a dentist, so I wanted to make sure that they go see you. So you get those referrals and you start educating in a bigger community. So I think the message is to make sure that at the end of the day, we take care of our patient as a whole, and not just as a one cavity, one deep probing depth. So that's important for us.
Absolutely. Yeah. That's the key message of this SalivaCast, and this is for you first-hand scientific discoveries translated to your everyday clinical practice and helping you to take better care of your patients. I'm so happy we recorded this podcast. I'll leave this on the feed. Please share it with your friends, share it with your colleagues, share it with your patients. This is information that not only impacts quality of life, but may even save lives. So it's very important information
Absolutely.
to share.
We'll share the publication link too, so people can download it.
Perfect.
Yeah,
We'll put in
absolutely.
the comments the publication link of the manuscripts that Dr. Surkit mentioned here. So if you want to read more, you can study more.
Absolutely.
Thank you so
Thank you.
much
It's a
for
pleasure
being here
always.
at Saliva
Thank you.
Cast. It's our first international guest, very special at Saliva Cast. At Saliva Cast, and for you tuning in here with us, you can always count on us to bring evidence-based dentistry to your clinical practice and to bring saliva diagnostics, helping you have every time more efficient diagnosis of your patients. I'll see you at the next episode of Saliva Cast. Dr. Sukir, you're always welcome to be here with us. Thank you so much, everyone. Thank you.
Thank you.
This